I'd like to welcome everyone to one of our Sikh Coalition Summer Series panels, Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Thank you so much for joining us. We are so excited to be working here at the Sikh Coalition to bring you all a week-long of virtual events, bringing community members together to learn from one another, discuss important topics, and to engage in fun activities for all ages. We have over 35 sessions planned for the Sangat for this week, and we hope that you'll continue to join us throughout the week. We are so excited to be hosting this very, very critical conversation today. We have titled this panel, Understanding the Need for Stronger Mental Health Services for Ourselves and for Our Communities. We are so thankful to be in the company of such incredible community advocates and professionals who are doing such amazing work in the mental health space in the Sikh community. So I'll just take a couple of seconds to introduce each panelist, and then I'll ask you all to introduce yourselves and talk a little bit further about your work before we get started. So to start, we are joined by Shuranjeet Singh, who is the founder and director of Taraki, a not-for-profit organization that works with Punjabi communities to reshape approaches to mental health. He founded Taraki in October 2017, following his experiences of mental health challenges, and now works with a team of 14 volunteers to coordinate projects in the UK and Canada. We also have with us Maneet, Chahal, and Jasmeet, Chagger, who are the founders of SOCH Mental Health. They're two passionate community changemakers who both have 8 years of mental health nursing experience and have closely witnessed their family and friends struggle with mental illness. They both founded SOCH Mental Health and kicked off their very first workshop in April of 2015. And lastly, we are joined by Dr. Varinder, who is a double board certified by the ABPN and in adult psychiatry and in addiction psychiatry. And he is an expert in treating mentally ill chemical abuse patients. He is currently the chief of mental health at North Medical Group in Fishkill, New York. Dr. Rathore brings over a decade of experience in spearheading healthcare initiatives and projects in the Sikh community. He's been instrumental in initiating Gurdwara-based health fairs and has done some incredible anti-addiction work in Queens, New York. Thank you all so much for joining us today. It is truly an honor to be in all of your company and to have you all join us. So for everyone who's joining us today, if you have any questions throughout the panel, please do ask us in the Q&A box. It should be on the bottom right of your screen. We will take some time at the end to answer your questions. Okay, so with that, I want to ask all the panelists if you could introduce yourselves very briefly, share where you're based, and what your role is in the mental health care or advocacy space. Just tell us a little bit more about your work. So
Awesome.
maybe, yeah, please go ahead.
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Thank you, Harleen. So everyone, my name is Shuranjeet Singh. I'm the founder and director of Taraki. And Taraki is a movement that works with Punjabi communities to reshape approaches to mental health. And as Harleen mentioned, I started Taraki in October 2017 after my own experiences of mental health challenges when I was transitioning from school to university. Some of the work that we do working with Punjabi communities is focused around raising awareness of mental health challenges and promoting positive mental health, looking at ways we can engage communities and build up skills through different types of education, thinking about social supports that work in spaces to really change the way we engage with each other and change the way we build our relationships. And also we find it's important to think about research, particularly within Punjabi communities, because, whether Punjabi or Sikh communities, we're often underrepresented in research, and we often see research that is done externally to our communities and done kind of by people who don't necessarily have particular knowledge of how our communities function. So we're really trying to change the narrative around mental health in a way that is thinking about what works for Punjabi communities and how can we leverage what works to promote mental health and promote positive mental health within populations around the world. So I'm based in Birmingham. I currently doing my master's over in Toronto. And yeah, I've kind of been doing this for a few years now, and I'm learning all the time. I'm never thinking that I know everything at all. It's just such a pleasure to be here and have a conversation with everyone and learn from, you know, Maneet, Jasmeet, and Varinder as well. So I'm excited to be here.
Thank you so much for that, Shuranjeet. Maybe if Maneet and Jasmeet, you want to go next. Thanks.
Jasmeet.
So I think it had just kicked me out. So if it happens again, Maneet, just take over. But I'm Jasmeet.
And I'm Maneet.
And we are both registered nurses. We are the co-founders of SOCH Mental Health. But before that, we are actually best friends. We've known each other since we were in grade 8. And we've actually bonded over the fact that both of our dads struggled with their own mental health challenges. You know, they both had depression, anxiety, and with mine, alcoholism was a huge factor. So there was a personal vested interest in mental health. And then when we became nurses, we realized that our South Asian community is still struggling with a lot of issues that we faced when we were younger. And in a nutshell, that's exactly how two best friends got together with the goal of changing our community SOCH about mental health. Just a little bit about myself before Maneet takes over. I'm currently working on my Master's of Science in Nursing, and that's looking at the impact of drinking on Punjabi families. So very interested in addictions, specifically alcohol use, and how it impacts our communities, because it is a huge issue that is overlooked very often.
And just to kind of add to what Jasmeet's shared so far, a bit about, I think, expanding on what we've been doing with SOCH. So we did kick off a community conversation in April of 2015. And since then, SOCH has evolved to be a community-driven initiative. All the work that we do, all the conversations that we have had and will have, it's been an input from the community, and also building that empowerment and facilitation skills within community members, either with lived experience or professionals that are, you know, really fond of this initiative and this community conversation. So we really cater to the needs of individuals. And I think the perfect example that we always use is that we had a community member reach out who lost a neighbor from suicide, who had postpartum depression. And, you know, this person who was actually pursuing medicine, we worked with her to design a workshop on postpartum depression and delivered that in Brampton. So a lot of the work that we do, it's very innovative, it's out of the box. We have a show called Upperni SOCH with the Sikh channel, and we do weekly episodes. Jasmeet was on the radio today, so I know she highlighted her conversation on our SOCH story, which anyone can check out. So we focus, you know, I think our vision kind of parallels and piggybacks off of Taraki, and it's been so inspiring for us to connect with Shuranjeet and for him to bring his insights and his views and work with us here in Toronto. And I think that's what today is even about, is how do we network and collaborate and make our community stronger. And, you know, SOCH specifically working from a health promotion lens and focusing on education, prevention, and building resilience, and having the community equipped with mental health knowledge. And for everyone watching today to know that we are all responsible for taking care of our mental health, and we are responsible to learn and educate ourselves so we can be a better member in the community. Jasmeet and I both have worked in the hospital, in the community. I'm actually done my master's. So it's been exciting to be here today and to put everything together. I'm not here as just a nurse. I'm here as a person impacted by a loved one's depression. I'm a person impacted by grief and loss. I'm a community member. So we're here in all of this together, and to really get rid of those power dynamics and have a very authentic conversation.
Um, Thank you. My name is Varinder Singh Rathore. Everyone calls me Vindi, so you can all call me Vindi. Uh, my sort of, first of all, I want to thank Harleen and Sikh Coalition for inviting me for this important topic. I think what I like to stress is maybe about 10, it's been almost 10 years, more than 10 years ago, I got a grant from the American Psychiatric Association to do mental health work and addiction work in a minority community. And, I talked to my mentor, and we decided to do it in Queens, in Richmond Hill. And we wanted to discuss issues like depression or mental health in general. And the way to really do it was very different than what I was learning in my sort of conventional training. Our community looks at mental health very differently, and they access resources very differently. So what we did is we did a series of health fairs, which were very well received in the Gurdwara. So it was very powerful for us. And so after doing that, I've been, I want to also thank Sikh Coalition, because Sikh Coalition really helped me develop the Alprani Malika Corps, really helped me navigate and meet people that could help us in the community. And we did ongoing health fairs, so it's been very successful. Since then, I've also been involved in Thrive New York, where we give naloxone kits and other kits to patients that are addicted to heroin and other opiates, and that's been something very positive. But to really, just two quick points. One is, this is our community. We're part of the Sikh community. We're proud to be part of the community, and we're only as strong as our weakest link. And when you have issues like mental health and things like that, they can really affect the quality of people, not only as an individual, but as a group. So what our goal is really to make our community strong and really advocate. And over the last few days, it's been very empowering. I want to recognize just Harleen Kaur, because I know how much hard work she's put into this. It's unbelievable. And just talking to Sharon, Jeet, Maneet, and Jasmeet over the last few days has been very empowering. Taraki and SOCH, they've created organizations. I think us in the U.S. are still far behind. So we have to catch up, but we have very good role models, and I'm really happy to be here. And I just wanted to say one quick thing. Mental health is one of those things, or mental well-being, we should say, is something that even the gurus talked about. And we're going to start a line from Gurbani, Sarab ka al khadnam, Sarab al khadnam, and it basically means the cure of all sickness is nam. So the gurus knew back then, 500 years ago, that even if, let's say, you're in a place where you don't have resources, where you don't have people who can advocate, really using nam and using the word of Vaheguru can help. And I think that's very powerful, and that's central to the Sikh ideal. At the same time, we are fortunate that living in the West, in England, in Canada, in the United States, that we want to really create a space, and we have the resources so we can address this on several different levels as well. And that's what we hope to talk about today.
Thank you so much, Vindi Virji, for grounding the conversation for us with a Gurbani book. I think that is extremely powerful, I think, for us as Sikhs, to recognize that we have many different resources from us, and we can, rely on mental health resources, we can rely on our community, we can also rely on our guru. So thank you so much for grounding us with that. And thank you all for taking the time to tell us a little bit more about your work. So I'm sure we will continue talking about your work throughout the conversation. But, considering the title and the topic of this conversation, it would be great if we could actually just start with talking about mental health itself, and what is mental health and what isn't it. It's clear that in our community we have a lot of learning and unlearning to do about mental health and wellness in our community and other communities at large. So can you share maybe a couple of misconceptions you've heard in the Sikh community surrounding mental health, and what you all have to say to those? Maybe just educate us a little bit on what is mental health.
So I'm happy just to kind of chip in first with one of the things that has stood out to me when I was just starting Taraki. I remember seeing a lot of discussion around male mental health, specifically within the news, within the media here in the UK. But then I remember having a conversation with one of my relatives, my mamaji, and he looked at me and he said, "Our mental health gore de jijiya." And for me, that really, really struck a chord. Not because I was looking at him and I was thinking, how can you think this? But I was looking at the people who were talking about male mental health in the news and in culture. And I saw people who did not look like him. I saw people who didn't represent his culture, his background. And I thought, it's really sad that this is what you think, but we're not doing anything to counter that thought. And so, and taking from what I have conversations with Maneet and Jasmeet as well, making that point that mental health is something that is not confined to particular communities. We all have mental health. Some of us may have very positive and very kind of good mental health. Some of us might be experiencing mental health challenges, but it's something that we all have. And they really make that clear whenever we have a conversation. And I'm really grateful for Maneet and Jasmeet for making that clear. And I think it's something that's really important for us to take forward today.
And just to even piggyback off of what Shuranjeet said, for those of us that are in Canada, you might have heard that 1 in 5 Canadians may suffer from a mental health issue in their life. And we tend to focus on that 1 in 5, but we forget that 5 in 5 have mental health. And that's exactly the message that, we're trying to get across, is that just like you have your physical health and you have to take care of that by eating well, drinking your 8 glasses of water, exercising, whatnot, you also have to take care of your mind. Your brain is an organ, and just because we don't see our mental health sometimes doesn't mean that it's not there. So for me, mental health is on a continuum, right? Like every day you're going to have changes in your mood. Whether you have a mental health diagnosis or not, that doesn't mean that you're going to stay like that for the rest of your life. There's going to be ups and downs depending on what is going on in your life. So I think that's something important to recognize as well, that it's a continuum, and your feelings, emotions, your actions, your behaviors, your bodily sensations all encompass mental health.
And adding to Jasmeet's point, today we're joined by a lot of different families and, hopefully kids. And I think the struggle here is, like, even with SOCH, we have a lot of people reach out that might be part of the younger generation. And they're like, yeah, I understand, you're communicating with me, but how do I talk to my elders? And I think using the language of SOCH, and that's why our initiative is called SOCH. And it's been really well received, when we've been doing Gurdwara workshops or engaging with our elders and saying, ਅਸੀਂ ਤੁਹਾਡੀ ਸੋਚ ਦੀ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ, like ਆਪਣੇ ਸੋਚ ਦੇ ਵਿੱਚ we have positive ਸੋਚ, ਆਪਣੀ ਸੋਚ ਕਈ ਵਾਰ ਵਧੀਆ ਹੁੰਦੀ ਆ, ਆਪਣੀ ਸੋਚ ਕਈ ਵਾਰ ਆਪਾਂ ਨੂੰ ਪਿੱਛੇ ਰੱਖਦੀ ਆ. And within mental health, like, we can talk about mental illness and people meeting certain criteria for it, but all of us are going to experience loss. We're going to experience hard times, and today all of us have been going through the pandemic, and we can't say none of us were not impacted by it. And, going through these changes, whether it's, losing a job or changes within your home or evolving relationships or disappointments or feeling the pressure, we all have mental health and we all have our SOCH, and we need to learn how to take care of our SOCH. How do we strengthen our SOCH to go through different circumstances in life? And I really hope that, if anything from today's conversation, you can take home the fact that you have mental health, your mental health matters, and to talk about mental health within the community by using the word SOCH, with, especially in Punjabi, it can be very positive, and it can drive home a really good conversation, because I think our elders do understand SOCH, and we have language for mental health, but, we have to look for it.
Yeah, I just wanted to add real quickly, I think the one thing that I'd like to stress here right at the beginning is we sort of need to undo what we're sort of taught. We are, it's not, oftentimes I would say, if you felt down or someone felt down, just be jardikala, be high spirits. Well, that's really good. But if you're not there, saying that can be sort of not feel right. So I think the most important thing is to really destigmatize and say, we're all going to go through mental issues. It's a part of life. But do we have, and I think sometimes how we do it, and not blaming the community here in any way, but sometimes how we go about it is actually the thing you're actually not supposed to do. So if someone's depressed, someone's anxious, what happens? We don't talk about it. We don't reach out to professionals. Why? Because we want to sort of keep it hush-hush. In my practice, I do have several Sikh people, and when they come to me, it's always like, when it's like the last breaking point. A lot of this could have been managed earlier if the parents were supportive, if the community was supportive. So what we're hoping to do with mental health is sort of hard to make an algorithm, but to just sort of maybe a light bulb will go off or a couple of things will sort of percolate, and then you can reach out to someone and then really make a difference.
I just want to add something to that as well is, when someone does come forward, and I know Shuranjeet, you talked about men's mental health, and it can be so challenging, I think, specific spaces, depending on which gender and which communities we're looking at, they're more open spaces for people to express themselves. And, and we did an episode with Shuranjeet on men's mental health, which you can access on the Sikh channel. But the things we also say, right? If someone's feeling depressed, like, think positive, like, tenu kyon depression hoya, tenu depression horn di ki lorda, like, you have your family, you're successful. And we quickly start to put the blame on the person, like, why? Like, rather than just listen to them, let them express themselves wholly and completely to you, because they're still trying to figure out what's going on. And I think that's the whole part of the mental health journey, is when you are going through challenges, it takes you a really long time to put that pieces of the puzzle together to understand, why is this happening to me? What am I going through? And if you don't know what to say, that's okay. Just listen. And that can be so powerful. And I know, Shuranjeet, you shared that, on the men's panel about within your home, how much of a role listening played when you were there, able to listen to a family member who was going through a hard time. And I think people underestimate how much listening can be and how impactful it can be.
And kind of like what Shuranjeet was saying, that the myth is this is like a white person's problem. And also like what you were saying, Maneet, like we kind of tend to say like, oh, it's okay, koi nahi, kuch nahi hunda, theek ho jana. I think another myth that I've heard a lot is that Sikhs don't get mental health issues. Like Sikhan nu nahi koi mental health problem hundi. And I know like when it comes to spirituality and religion, in healthcare, that's a huge aspect that people should focus on. But a lot of the times healthcare workers do shy away from it because it's considered one of those, political topics that you don't want to get into. And of course, like for individuals, whatever their faith is, like say today we're talking about, there is
Jasmeet, it seems like we are starting to lose you a little bit. You're
like not listen to the person. Like someone has to be within a mental to understand what Gurbani is trying to say and how to apply it to their lives. So even though that is such, is it still disconnecting?
It was disconnecting, yeah.
Okay. Yeah. Sorry, guys. I tried to do everything with, but yes, spirituality is important, but you shouldn't tell someone that praying will make their problems go away. And seeds do have.
Absolutely. I think that's actually a great segue. So this panel is about also understanding services for our communities. I think we could talk about mental health and our own experiences in the community for hours, but I think it would be great if we could actually pivot to talking a little bit more about services. And I'm seeing actually a lot of questions already starting to come in, and some folks are even asking direct questions on how can they access better mental health services. So I think it would be great if you could speak a little bit to what kinds of services are available for folks who are looking to seek care. And one question I'd love if you could specifically touch on is, how do you know when it's time to reach out for help?
So I can just kind of cover that. How do we know when it's time to reach out for help? Just from my personal experiences, and just outlining that, I'm just going to talk about the time where I knew I needed to reach out for help. That might help someone else to understand their own situation, but at the end of the day, it's kind of my experience from my position. So when I was going through pretty debilitating social anxiety when I was at university, I remember contrasting myself and looking to what I was like before university and just thinking, why can't I speak to people in the same way? Why can't I engage with people in the same way? And I remember one particular event that there was at university, and I thought, you know what, this is going to be fantastic. I'm going to go in and talk to loads of people. And I was in there and I couldn't speak to anyone. And I remember going out of the room and just standing there checking the sports like kind of scores on my phone, going back in and not being able to speak to anyone, and going back outside and coming back in. And I realized at that point that there was something that was stopping me from living my life how I want to live my life. There was something that was stopping me from doing what I wanted to do in that moment. And that was the point when I decided that, I need to seek some help for this difficulty. So for me, it was just the influence that this thing that was having on impacting my life in such a way that it was stopping me from doing the things I wanted to do. So yeah, that's when I kind of reached out for help.
One thing I can add, thank you so much for that, Shuranjeet. I mean, I think that's very powerful. I think one of the points that I'd like to sort of add to that is oftentimes when patients come in, we look at what, they sort of have a regular functioning or a regular way of doing things, a regular way of interacting with other people. They enjoy certain things in life. Their sleep, they go to sleep and wake up, and something switches. And sometimes it can be what we call a stressor. It could be something that occurred in their life, a loss of a loved one, some financial stress, an exam that didn't go their way, or sometimes it could be nothing at all. So when we do have a stressor, and then we call it an adjustment disorder. There's a clear reason, and then you have a change in that normal functioning. Where you used to enjoy being around certain people, you're isolating. And isolation is sort of a very big sign for us because when you're alone, your thoughts can go anywhere. Change in sleep. So if you have a loved one and you notice a change in sleep, they're isolating, not eating, not sleeping well. These are signs that something is changing. And if there's no stressor, then we sort of qualify it as major depression. I think a change in functioning and change of these sort of key things, your sleep, and those guilt feelings of, you're feeling down, but you don't know why. And that's okay if you don't know, but those are sort of the telltale signs that we use.
I'm going to come in from a health promotion and a prevention and building resilience type of lens. And I think that's kind of where SOCH and a lot of the work that Taraki is doing is focused on is we wait until, and I know Dr. Rathore talked about that, you hit a breaking point and then you go for help. And, with Jasmeet and my experience of working in the hospital, I myself working in an acute mental health unit, Jasmeet worked on a schizophrenia unit, and then we transitioned into the community, working 5 years as community mental health nurses in Brampton. You see that huge gap in getting the help that you need. And, for years, people talk about, I was thinking that something wasn't right. I was struggling. Like, if you're a young student today joining in and school is hard and you're not able to cope with that, you're having relationship issues, you're dating and, a loss of a relationship, a loss of a loved one, you're having anxiety, you're having depression, or you're just not feeling your full self. I think that warrants to ask for help and ask for support. And there's never a right time. Of course, when things are hitting a breaking point, that is perfectly obvious that you need to go seek, mental health support. But I think let's kind of move early on. Even for myself, I want to give an example. I lost my dad at the end of 2018. I'm a mental health nurse. My best friend and I co-founded SOCH Mental Health. I'm on a platform where I know a lot of information, but loss hits hard. And my family and I actually went through grief counseling. And even though I know information, I know what's going to come, knowing something is one thing, but I think working with someone on managing your day-to-day, learning the skills, and some of us we did group grief counseling, some of us did individual one-to-one. I don't think there's ever that right time. you can always go work. You can always, you know, whether you're accessing a life coach, a spiritual counselor, talking about mental health in community spaces to learn more, self-help. And I think, Harleen, this might be a good point to transition to our slide and services, in terms of there is such a big spectrum of what accessing help looks like. It's not always going to the hospital and, you know, going to your family doctor. And I'll kind of let Jasmeet talk about the different ways of getting help and how that can vary. And once again, reminding everyone, mental health's on a spectrum, and kind of echoing Shuranjeet and Dr. Rathore, is that if you're feeling that your day-to-day struggles are getting very challenging, what are the different ways that you can start a conversation and connect with supports, but also look at it from a health prevention and building resilience. You know, I know parents that work with like a child therapist. There's artist therapy is actually really well known here in the GTA, and there's families that go and work with a child therapist in terms of building skills and having this child develop healthy coping. So I just want to say it's never too soon, or never too, like, it could be too late, but it can't be too soon.
So this is actually just a very basic graphic that we've created so people know that there are different options when we are seeking mental health supports. So usually we do recommend that you do check in with your family doctor at least once a year. We always go for our, or not always, we should go for our physical health exams. And you can also let them know about your own mental health, because not all doctors have that focus. And if you do feel that you do need to go to your family doctor, and sometimes they're like, okay, you can only talk about one thing at a time, you can call ahead and schedule a longer appointment and let them know that you want to discuss mental health, because the family doctor is the gateway to other specialists. So it's always important that they are up to date on your physical and mental health needs. Maneet did mention the hospital. So with that, that's usually like if there's like an emergency situation, someone needs to be admitted, they might need supports of a professional, an inpatient assessment. The hospital is always there as well. And we've seen in our work that oftentimes people don't know how to access help. And if something is happening in their homes, in the community, they usually pick up 911, call 911, or they'll go to the hospital when they could have used other supports as well. And there's community mental health agencies. So of course, I understand that a lot of the participants are from different parts of the world. So if you need more information on specific mental health agencies in your region, you can always give us, like you can check our website, and you can also send us an email and we'll help connect you to specific agencies. But in Canada, we have the Canadian Mental Health Association, and they have chapters in every province. So that's just one example for our Canadians. We've spoken a little bit about counselors. So like Maneet had mentioned, sometimes if we are in healthcare, we are a little hesitant to get professional help because we put this guilt on ourselves. Oh, I should know better, or I'm a mental health nurse, I should know how to take care of myself. But like even Maneet mentioned, you know, she's gone through grief counseling. I've been seeing a psychotherapist for the past 2 years, even though I'm a mental health nurse. Right? So a counselor has about 7 to 10 years of training. Just like your family doctor has specific training, a counselor is there and they're trained to help you identify your problems from a neutral lens. Because sometimes we get so caught up in our own thinking, it's hard to break those patterns, and it's hard to see our situation from an objective lens, and they can provide that unbiased, neutral opinion. And they can also provide you strategies, because sometimes in the Punjabi community, we're like, well, you know, why am I going to talk to a stranger? Like, already nahi pata. But it's very similar to going to your family doctor. Yes, we have Google and we all search our symptoms, but we still need to go to our family doctor for certain things. Same thing, we sometimes need to get the help of a professional who has all of this training on the strategies that can help us. There's our loved ones is on there, because even though counseling is specific, and talking to your family is not counseling. Talking to your loved ones is not counseling. You still need the support of your loved ones. And there's also self-help. Some people are very self-driven and directed. There's so many YouTube videos, books that you can access. I'll just leave you with one example. For individuals that might be struggling with anxiety, there's something called Mind Over Mood. And you can access that on like Chapters or Indigo or even Amazon. It's a self-help book that helps individuals figure out their anxiety patterns, and you can actually write stuff down. So that's also some information. Once again, if you need specific resources, you can always give us, give us a shout, and we can help direct you to the resources in your community.
I just wanted to add, which is really exciting. So for anyone that's been following Pink Laddu, they put out a poll online about just, they had a lot of influx of messages asking about mental health and support. So they actually now created the first global directory for South Asian therapists. So of course, right now, the website just launched, and I know there's, a number of therapists that have registered across Canada, UK, US, and it's southasiantherapist.org. We will, we've posted the information on our social media platforms and even shared on how do you go about finding a counselor, or how do you go about accessing mental health supports. If any of this information, it can be a lot sometimes when we're having a conversation, but just to remember, I think the message here, just to, add everyone's comments in summary, is that there are people out there to help. And if you don't know where to go, don't feel overwhelmed. Feel free to email us at SOCH.
Thank you all for sharing this very, very critical information. I know that a lot of folks struggle, once you know that you need help, struggling where to go next, and knowing, what is the right step to take next. And I think this graphic itself is extremely helpful, but I'm sure that everyone who's joining is looking forward to those resources as well that you just mentioned. So given that we have about 20 minutes left in this conversation and so much more that I know we want to discuss, I'd love if we could pivot to another side of this conversation, and then also try and leave, maybe 10 minutes for Q&A, because we're getting a lot of really good questions from folks who have joined us. So one part of this conversation is understanding services for ourselves, but the other side, I think, is also talking a little bit about community care. And I know that all of you have done that in many different ways in your work, both as professionals, but also just as community activists and advocates who organize community in such thoughtful and creative ways. So I would love to hear, I'm going to pose a couple of questions, and then feel free to just answer whatever resonates with you. But I would love if you could share, some examples of work that either you have done or you have seen done in Sikh spaces that have really worked to help unravel some of the deep stigma that we have in our community surrounding mental health and wellness. And then also kind of taking some questions from the Q&A that we're getting. What are some concrete steps that folks who are attending can take to make change and help advocate for better access to services and better community care? What can we do in our local Sanghats to help address some of the issues that folks face? And then, one thing that I think about a lot is, what can we be doing now to create a culture that is more open and more welcome and safe for our youngest Sanghat, our young people, to actually feel empowered to talk about the struggles that they go through, their mental health, whether it's, positive mental health or maybe some issues that they're having with their mental health and wellness. What can we do to try and foster that kind of community? So I'd love to hear your thoughts.
Awesome, thank you. So just talking about the different types of community services, which I think have stood out. There's one that immediately comes to my mind, and it is the Varinder City Forum, which is a open group for Punjabi men that we developed in late 2018, and it currently happens in London and in Birmingham. We've also been working with SOCH in Brampton to get something going as well. And the background for this work was that I have obviously, you know, being a guy, Sikh guy, Punjabi guy, I've grown up in a lot of spaces where I've been with other kind of guys my age, and I noticed that our way of building relationships was always, it was never about talking about us as people, talking about our emotions, talking about how well we're doing, how difficult we're finding things. It was always based on other things. It was about cars, it was about, you know, PlayStation, it was about things that you can just imagine teenage guys talking about. And we wanted to really create something that started changing how these relationships would be formed. We wanted to create something that would start to unlearn particular rules that we've been brought up with and start to rewrite those rules in a way that allows for open and honest conversation. And so these Giant the City forums for Punjabi men, they have about 8 to 12 attendees to each one. Everyone takes a few minutes to do some breathing meditation at the start. Usually in each one, we cover a topic that is either directly or indirectly related to mental health. So for example, we can talk about, you know, talking therapies, or we're going to talk about physical well-being and mental well-being. But what I've seen in these discussions is that there are so many people who want to talk about these things, but we often do not offer them the spaces to talk about these things as a group, to talk about these things in an environment where people are encouraged to talk about topics that they wouldn't talk about with family or friends. And there's, you know, a small example from one of the forums. Right at the end, someone who hadn't spoken very much had a little discussion and they got a bit emotional. And I was like, okay, let's see how the rest of the group reacts. And one of the guys got up at the end of the group and went to go and sit with him and said, you know, thank you so much for speaking up. That's so brave of you to speak up. And then as soon as he'd said, that was so brave of you, all the other guys were like, that was so good of you. Like, we're here with you. You know, we're here to support you. And that just showed me that these rules that we think we've learned, you know, for all of our lives can just switch like that. And we all have the potential to have these conversations and to have the space for these conversations. You know, linking into your second point about how do we enact change now? Everyone watching this, we might be thinking we're watching a mental health related panel because we might be concerned for another person, you know, we might be concerned for a family member or a friend. But all of us, and Maneet and Jasmeet have heard me say this many times, all of us have that potential to enact change around how mental health is approached, how we discuss mental health, and importantly, creating a space that actively encourages people to talk about these things without fear of judgment, without fear of stigmatization. Because sometimes it just takes one person to prove that this conversation can take place, and then everyone feels a bit more comfortable. And being that one person can be difficult at times. You know, it takes a lot of courage to have that conversation. But I know as Sikhs, we have a lot of courage, and we have so much that we can connect with to really change, you know, borrowing from Maneet and Jasmeet again, to change our SOCH. So yeah, you know, everyone to know that we might think that change comes from different people. There's other people can start the conversation, but in reality, all of us can. All of us can make that space a bit more comfortable for someone else, make that space a bit more open to conversation, and then we'll see things flourish. And slowly, we'll see communities be able to support each other in more effective ways.
And just to kind of go off of what you were talking about in regards to how we all have that potential, I think, you know, there's that saying like, be the change you want to see in the world. So I think before we start trying to change other people's SOCH about mental health, we really need to, one, reflect on our own SOCH about mental health. What, you know, stigmas do we hold? What are the biases that we currently have? So really start with reflecting on your own thinking. And then you can even, the next step would be to really reflect on how are you or how are you not supporting your mental health? Before a conversation like this, did you even consider that mental health was an essential part of your well-being? And this is something that my therapist told me at our very first session. She was like, you need to treat yourself like your best friend. And we tend to, you know, we're, especially as Punjabis, as Sikhs, we're very giving. And when it comes to ourselves, sometimes we kind of take a back seat. So really think about, how are you working on your mental health, and what are things that you can do to be your own best friend and take care of yourself, and actually implement that into a daily routine. Because it's not just like self-care is a one-off thing. What are little things that you can do every day to support your mental well-being? And then educate yourself. Like, education, knowledge is power. You know, educate yourself on mental health, different mental illnesses, what resources are there in the community. And then from there, when you feel a little bit more comfortable in mental health, you can speak up. Because I'm sure we've all been in situations where someone has called someone boggle or said something. And now when you have that knowledge, you're starting to change your SOCH. And I know I said when you're comfortable, but sometimes we also have to do things that make us uncomfortable to have some growth. So when you do feel ready to have that conversation with someone, I understand that in our culture, you know, when it comes to elders, sometimes we think they don't understand, and it's hard to challenge their thinking because, you know, we have that dynamic with the elders. But I'm not saying be disrespectful. You don't have to argue. Listen to their perspective, explain yours. And even if you're born and raised in a Western country, that doesn't mean that you know what mental health is. There's so many first generation, you know, Canadians, you Americans, people from England that still don't understand. So be open to speaking up about mental health as well. So, and I guess I can let Maneet talk a little bit more about specifically the strategies that SOCH has implemented in a Sikh space.
Could I just get in there? I just wanted to just say one thing. What we've noticed in the community outreaches that we've done with people in the Queens area in New York is that they will look at diabetes as a disease. They will look at hypertension as a disease. They will look at cholesterol as a disease. But when it comes to mental health, it's somehow not a disease. So they will talk about diabetes. You know, diabetes is you know, sort of an epidemic in our community. So is cholesterol, so is hypertension. But do we know that one of the major causes of depression and other illnesses, mental health illnesses, are actually these medical causes? So if someone has diabetes that you know, or if diabetes runs in your family, or hypertension or cholesterol runs in your family, there's a higher possibility or a higher probability that they suffer from depression, that they suffer from anxiety, that they suffer from sleep issues. But do we really tease that out? And what we've seen in the sort of community outreaches that we do, that people are willing to get a cholesterol checked, they're willing to get their sugar tested. But if you build, you know, you bring up mental illness or you bring up depression, there's like you know, it's like not a disease. So one thing that's important is that mental illness, depression, anxiety are a disease, full stop. Just like diabetes, just like hypertension. And we are still not there. We think it's a weakness. We think there's something wrong with us. And that stigma carries to the whole family. Say, you know, bagla na dabbar. You know, if one person is sick, it doesn't just stay there. The whole family is somehow stigmatized with that. What we found, though, is with individuals that we've worked with on a large scale, is that they're not going to come out and talk about mental health. They're not going to talk about these sort of conditions. But what they will do is they will come and get their sugar checked. They will get their cholesterol checked. And that's a very good segue. So if you have a patient that is maybe self-medicating with alcohol, they have depression or something, they're medicating with alcohol. If you tell them, hey, look, you shouldn't drink, it's going to affect you, you might get a DWI, it may cause domestic violence, that doesn't really work. What does work is if you get their blood drawn and they see that their liver enzymes are elevated, and you can say, hey, look, you know, if you keep drinking, you're going to pass away. So I think that is a very important piece for our community to get, that it is a disease just like any other thing. And even as I'm saying that, I'm sure a lot of people are like, well, it's really not. It's a weakness. It's this or that. But no, just like any other condition, mental illness, depression, anxiety, they are actually diseases. The most important thing, I think, what I'm getting from here is that you guys have the resources in England and Toronto really created this wonderful groups. I think in New York, because we're in the East Coast, we're a little more spread out. We don't have those resources. but I think we do need to sort of put that together. The most important thing you can do is have someone that is non-judgmental. Even that one person can make such a difference, and sort of do what we call a medical 360. You have your primary care doctor, have your psychiatric help, but also have someone you can talk to. So we call like a medical 360 that you should try to access.
Thank you so much for sharing that. And I actually have a couple of follow-up questions that I'm seeing from the Q&A. I figure we can just bring those in now. But Vindi Virji, I think that was very interesting, your point of, how can you creatively get folks to pay attention to their, issues they may be facing with their mental health that they may not understand. How do you get folks even in the door at first to a health fair? So I've seen some questions that kind of all allude to, when organizing a community space, do you have any suggestions for creative ways to get folks in the door and to get folks to pay attention and to attend whatever session you are holding?
Yeah, no, I think that's a good question. In the Gurdwaras, what surprised me when we went to the Gurdwara and we spoke to them, they understood that there was a need, and they were pretty open-minded. They were open to discussing HIV, open to discussing hepatitis C, and I think the best approach that we can do for our community is to frame it in a medical space, use the medical piece, and then bring in questions of depression, of anxiety. And the key to remember is, you have a wide variety when it comes to the Sikh community. You have older generations that are going to look at things and they're not going to tell you how they feel. They're not going to tell you all these sort of, what we call sort of psychological symptoms. They're more going to say, oh, mera gorda dukhda, meri lat dukhdi, right? So we were like, oh, I'm a massage karda. But really, what's going on is there's something deeper. So a lot of people in our community, they cannot even access those symptoms. And so they're going to say sort of like a physical illness. So really meeting them and going at it from a very medical standpoint is probably a better approach.
And just to come in on that as well, just as has been said, we can be so creative in where we have these discussions. I think it's easy to say, this service can be located at this health center and all this kind of stuff. That does not mean that anyone is going to walk through that door and access that service. But how can we take this type of information? How can we take this health promotion, mental health promotion, to places where people already get their information, to places where people come together? Obviously, the Gurdwara is a really important place in that regard. But then also we have sports clubs, we have seniors clubs, we have, one of the things that we really like to do, and we're going to push a bit more, is combining mental health and physical health related engagement. So people can come and do a small circuit, and then have a little discussion afterwards. So people aren't just coming for the discussion, they're also coming for that physical health aspect, and it gives them another reason to attend. And one of the other small things that we've seen is, people engaging when we have like creative expression workshops and stuff like that. There are people who will engage with that because they want to understand how to create, express themselves creatively. A really important part of that conversation is understanding feelings, understanding emotion, and being able to communicate things. So there are so many different kinds of skills that we can develop, which don't need to be directly related or very obviously mental health related. There's a whole host of discussions, and we can be creative in how we have them.
And it's just to also say that mental health doesn't always have to be a serious discussion. It doesn't always have to be a serious conversation. And I think we've been learning from each other, SOCH and Taraki, is how can we do this in creative ways? And also to really highlight myself and Jasmeet being mental health nurses and Shuranjeet being someone who had lived experience. I think this idea is that if you have a passion and you have an interest and you put something out there, we have our respective platforms. Feel free to connect with us. Who can we network? There's other amazing organizations. There's SAMA, so South Asian Mental Health Awareness in BC. In UK, there's also Secure Mind. The Brown Psychologist has her own platform. There's Man Mukti, which is a South Asian initiative in the States, but it's not Sikh focused. So there are things that are popping up now, but I think the idea here is, and what we've seen is that storytelling is very powerful. So when one person speaks, you create a space for it, whether it be at the Gurdwara or all the other places that Shuranjeet talked about. But also it takes a whole community for this to happen. Like for us in Toronto, we had a very hard time to get into the Gurdwaras, being two young females, going in with this, this idea of how we wanted to build the community's education about mental health. But what ended up happening is that our consistency and finding other platforms and doing community workshops, partnering with your local library. You can have community conversations at a library and invite people through the Indian radio station. I mean, now with the internet, there's such an amazing way to network. If you're a student, maybe start a club at your school. You can even be a high school student and start this club, and it can be published in your local newspaper. And that's how it starts. It starts very small, and that's how SOCH started. But it takes everyone. I mean, we had a hard time to get into the Gurdwaras, and it was actually, we did a lot of this other work around, and now the Gurdwaras reach out to us once something has happened. And of course, that's very tragic. Why should loss lead to now a mental health conversation? Like, we're trying to do that prevention piece. But if you are someone with like a pull in the community, you have a network with the Gurdwara committees, because it can be very challenging to get these things passed, or you have, it doesn't matter where you work, what you do, if you have a pull in the community or even within your own family, you can start having SOCH conversations, mental health conversations, and that's pretty much how it starts.
On that point, so just to bring a couple of other questions from the Q&A, and folks who are asking questions, I apologize. These are all amazing questions. We just don't have the time to answer every single one. We can go 10 minutes more if you all are okay with it. Does anyone need to jump? Are we okay to go 10 more minutes? Okay, great. So just to bring some other questions in. So speaking about things we can do in the community and small steps to make a difference. Do you have to be a mental health professional to have these conversations? And, it seems like a lot of folks are very interested in starting things like this in their own communities. I'm seeing some questions specifically about how we can get these conversations started in the US, and especially on the East Coast, since we have less resources, like Maneet was saying, and we're a little bit more spread out. What suggestions do you all have for starting those conversations, especially for folks who may not have a mental health background? Are there resources you can point folks to? And really, I think the most overarching question is, do you have to be a mental health professional to do this kind of work?
So I would say you don't have to be a mental health professional to do this kind of work. You can have lived experience. So lived experience is usually someone that either themselves has gone through a mental health challenge, or they've witnessed it in their community, in their family, or you could just even have a passion for mental health and education and working with the community. So kind of like what Maneet was saying, if you have an idea and it currently doesn't exist, which is what happened with us, we were mental health nurses who wanted to work with the South Asian community, and that job didn't exist, so we created it for ourselves, right? So, and also going back to what Shuranjeet was saying, we place a lot of limitations on ourselves, but we all have the potential. So like Maneet, so once again, if you have an idea, like Maneet said, seek out organizations that are currently existing. If your city doesn't have one, you can always reach out to, whether it's a different city, a different state, a neighboring place. You can reach out to SOCH, Taraki. We can connect you to other resources as well. So it's that networking that's really important. So I think that's like a good place to start, and pull in the community. If you have connections anywhere, like Maneet said, get those people on board. And even if you have like an event and like 2 people show up, it's not about the quantity, it's not about the quantity, it's about the quality, right? So those 2 people that come, they will get something out of whatever event you're doing.
And our first mental health event, I want to say, was mainly our friends and family. And it's so exciting now, like, when we hold events, and I'm like, like I can't see my friends and family, and I think that's how growth happens. It's very small and steady. Also, just recently on Instagram, I saw like a mental health Sikh initiative that started in Australia. I sent them a message. I'm like, looks really exciting what you guys are doing. Would love to connect with you. And I think this is how we're empowering each other and we're working all together. So kind of honing in on Jasmeet's message that, please reach out to us at SOCH or Shuranjeet with Taraki. And this is how like we can use social media and we can use the internet in a positive light to direct change.
Because that's how we connected with Shuranjeet. It was over social media. So connections are totally possible.
And just to come in a bit on that as well, I think it's always important to be connected with mental health professionals. When you're doing this work, we need to also reflect on why we want to be doing this work. We could very easily think, we want to go out and change people, but that's not what we're doing this work for. We don't change people in inverted commas. And we need to understand where our boundaries are, especially as I'm not a mental health professional. I know that I can listen. I can create a space where we can listen, but then I also know that if someone wants support that I can't offer, I know where to signpost them and I know which type of resources are available. And so for those who are thinking about starting something, yeah, definitely feel free to get in contact. We've written some kind of frameworks for how to direct these types of conversations. But in reality, a lot of groundwork needs to be done before something actually happens. We need to be mapping out what's available, mapping out what's actually happened already, learning about what has gone right for them, what has gone wrong for them. And importantly, we need to put our love into this because this isn't going to be for us. This is going to be for people within our communities. And so when we do this, we want to do it right, and it's possible, but it is a commitment.
Well, a couple of things that I say, there are certain cases that are specific to our community. I think depression, mental health affects all communities, including the Sikh community. There's certain cases that are specific to our community. For example, over the years, I've had young boys that have wanted to cut their hair and their family is against it. And it's a big sort of issue for them. You've had issues where girls may be forced into certain marriages or certain things that they don't like, but these are very difficult discussions to have. And what I've noticed is a lot of times these discussions, just like, let's say a young person wants to cut his hair, you talk to them, you sit down with them and listen, but they've always been the most challenging cases for me because that continuity is not there. The next step you get them there, you talk about it, and it could go either way. At the end of the day, it is a personal decision, whatever one decides, and you have to be respectful of that. But you always get this feeling that you didn't do enough or you could do better. And being in an area where we don't have those resources, we have to sort of tap in, I think, certain individuals, and it shouldn't, I think it should be both. I think it should be medical professionals in the sense that if there is suicide, we've had cases where there is suicide or very serious behavior. But at the same time, you want to have someone on the grassroots that can really knows the community well and can sort of implement these issues and refer back and forth.
There's also training available. So I know in Canada we have like mental health first aid training. Shuranjeet, I believe that's available in the UK as well.
And in the US as well.
Exactly.
Yeah, and on the East Coast, Thrive NYC offers it.
Yeah, so that's a great starting point, like to build your education and skill set about having a mental health first aid for those who are mental health professionals. There's other advanced training. They're in Canada, and I'm sure it's also in the US and the UK, suicide prevention training. And I think that is something everyone should have. And you never know, right? Like when someone is showing signs and symptoms and how you can really help and support them. Suicide is a very big issue. And the reason we were invited into a Gurdwara in Hamilton was after a suicide. And these are issues that are very large. And also back to Shuranjeet's point, a lot of people are now seeing mental health conversations and they see all the, I guess, with social media and us sharing our platform, it seems very exciting, but it's a lot of work. Evenings, weekends, our families are waiting while Jasmeet and I are on conference calls. Food is getting cold, and
right now.
And so it gets really hard. It gets exhausting. Like for us, it works because we have there's two of us and we're growing our team. And so we're able to lean on each other, and to have that, it is something that, yes, you can have an interest, but to be successful and also to be healthy, you need to have a balance. And I think that is, I loved how you said that, Shuranjeet. I'm so happy you brought that up.
Thank you all so much for this very powerful conversation. I feel so bad that we have to end very soon. I just want to make sure that we're addressing one more general topic from our Q&A. So it seems like we're getting a lot of questions specifically about work on the East Coast in the US. So Vindi Virji, we've gotten questions wondering about your work in Queens. Malika Kaur was wondering what changes have you seen, if any, since you started that work in Queens? And then we're also getting some questions on, what can we do as, Sikhs who are here on the East Coast? What can we do to make a difference here? Are there resources that we can leverage? Is there help that we can be getting from SOCH Mental Health and from Taraki to be starting that work here? Yeah, and then one more very specific question that Vindi Virji, if you want to be sharing afterwards in an email that we'll send with more resources. Folks are wondering if you have, referrals for other Sikh therapists or psychiatrists in the US who may be able to even offer pro bono work, considering the very high cost of healthcare in the US.
Yeah, thank you. I think first thing is after 9/11, we did see an increase in bullying. We did see an increase of a lot of young boys, in particular, being traumatized in the schools and things like that. And we did take it upon ourselves to do pro bono work. So if you need an evaluation or anything like that, you can contact me, and there are other psychiatrists that I can reach out to, and we'd love to do that work. It's really, we're passionate about it. And we really want to help out, and there's no shame in that. We really enjoy doing that. As far as, I think you're very lucky if you live in England or you live in Brampton. You have wonderful support with SOCH and, Taraki. Most of us in the US, we're still very spread out. I think it's something that we need to create. We sort of created it. We had a health, we had, as Malika said, we had these community fairs. And I think the long-lasting impact of that, I think, I still see people wearing the t-shirts. We handed out t-shirts, people are wearing that. People come up to me and say, it was very helpful to have this discussion around, alcoholism and things like that. But the long-lasting effect hasn't been there. So I think the next step is for us to also create an organization similar to what they have there and really man it. It's a big responsibility. I think we're up for it? Definitely. I mean, I think, in New Jersey and other areas, there's a very good Sangat, and we need to do that. Most important thing I could say is most people are not going to have those resources immediately in their, network or what it is, but you can reach out to Sikh Coalition and they'll get you in the right spaces. How I found out about these bullying cases where I got involved and we did the evaluation was through Sikh Coalition. And you guys do a lot of great work. So I think the most important thing I could say to anyone is this is something that you should not suffer in silence. If you reach out, it will be held in confidence. And I think that's very important for our community. When we talk about it, that this is not going to be shared by everyone or things like that. This is going to be very much held in a doctor-patient privilege type of setting. So it's going to be very confidential, and that's very important.
I just wanted to add, like, in terms of resources, and I think, where social media is very powerful is that now with COVID, a lot of programming and a lot of talks are moving online. So to use, look into our social media platforms. We have the ongoing episodes that we're doing with the Sikh channel right now, Apni Soch, weekly topics, and a lot of health information that is shared and storytelling. And I think that is a great point to know, that you don't have to, sometimes information is not just limited in your city. It is available online, and that we do post ongoing resources and engage the community on our social media platforms, as well as Taraki. So to know that is a resource to everyone joining today.
Okay, well, it seems like that's all the time that we have. It makes me sad because it's such a powerful conversation, and I know there's so many more questions that folks have, but I really feel like that shows us how needed this kind of conversation is, you know, and how much more often we need to be engaging in this kind of dialogue with each other. So I just wanted to share the contact information once more of all of our amazing panelists. So if you just give me a second, I will share my screen once more. So unfortunately, we don't have Dr. Rathore's contact information on this slide, but we promise to get back to you all within 24 hours with contact information and, you know, how you can connect with these amazing community advocates who have joined us today. You know, I know that they have shared that they're more than willing to connect with folks who have joined. And I know that there are many more questions that are left. So I really do hope that you all take the opportunity to connect with these folks who are doing such incredible work. And then I just want to personally thank you all for joining this conversation and for, you know, lending your expertise and your time to join us and to engage in this really important community dialogue. So if you see all the participants here, there is an exit poll that we request that you take before you leave. And the our lovely panelists also have a survey that they would like to send out to everyone who has joined. That survey will be out shortly. You will get it via email. But, you know, it's very important, they've shared, to collect data surrounding this kind of dialogue. So we really hope that you will take that survey and connect with our amazing panelists. Thank you all so much for joining us. We are very, very thankful to have your support and to be able to have had this conversation with you. So the Sikh Coalition Summer Series program, it's continuing for the rest of the week. We have over 35 sessions for all ages. So please take a look at the rest of the week's sessions and make sure that you register at sikhcoalition.org/summer series. And we really hope that we'll be able to see you for more important conversations. And just to address a couple of questions that were shared with us, there are some questions specifically from parents. We also have another mental health panel scheduled for Saturday, specifically about understanding your child's mental health needs. And we really hope that you will join us and ask those experts their thoughts on your questions. So thank you all so much. Thank you, all of our panelists.
Thank you, Harleen, for inviting us and doing all this hard work.
Of course, so
Thank
happy.
you, really. And showing an interest, because it's one of those things that sort of goes underneath, you know, the covers there. So thank you.
Of course. We're very, very happy to have this conversation with you all. Okay, it seems like it's time for us to jump. Thank you all. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.